Hi everybody. So today's topic is ECG changes seen in cases of hypokalemia. So this usually comes as a 2-mark question. So tell me guys, what is hypokalemia? See, hypokalemia is when the potassium level, okay, the Malayalam class, the potassium level, what is the normal potassium level in the body? That is 3.5 to, one second, it's too bright. Okay, 3.5 to 5.5 milli equivalents per liter. That is the normal potassium levels in the body. Now, if a patient gets diarrhea or he has malnutrition or vomiting or renal problems where there is excessive potassium loss, like renal tubular acidosis and Cushing's syndrome. So ividakke potassium loss can be seen. Even in magnesium deficiency, magnesium is important for potassium reabsorption. So magnesium koravaavuna samayathum there could be what? Hypokalemia. Potassium koravaayirikkum ayalde body il. Now see, potassium koranyal what can happen to the body? Why should we worry about hypokalemia? See, potassium is very important for the neuromuscular function. See, for the respiratory muscle function and all the muscle contractions, your potassium is very important. Now the main reason if there is hypokalemia, cardiac arrhythmias can occur, right? There could be muscle weakness and sometimes there can be respiratory muscle paralysis or weakness. That is the diaphragmatic paralysis can occur. That's very dangerous. It can even lead to death. Now the question here is, guys, what are the ECG changes that you see in hypokalemia? Okay, now you will tell me, okay, this is a normal ECG. This is the P wave, very simple. Okay, so see, don't go too much deep into on how the ECG changes occur. Usually this comes as a 2-mark question. So just write these 5-6 points. I think that will be more than enough. So first you draw the ECG, normal ECG. This is P, then P wave, then you have the QRS complex, and then you have the T wave. This much clear? Okay, all of you know that. Now what happens to the T wave? See, the T wave in hypokalemia, what happens? T wave in amplitude korayam. So T wave can either get decreased, okay, or it could be absent, or it could be inverted. So T waves either in the amplitude korayam, right? Or the T wave could be absent, okay, or the T wave can be inverted. This much understood? The next feature is, guys, ST depression. So ST depression, see, look here. So this here, ST segment, it can be seen as slightly depressed. So ST segment depression. Next is P wave. So what happens to the P wave? In P wave, what we can see is a tall P wave. Okay, tall P wave. Now see, this tall P wave, or actually my charge is too low, my phone charge, it might get disconnected. I hope it stays till the end. Okay, now even if it goes, it's okay. I'll continue after I charge it, right? So see, what happens to the P wave? Here the P wave might look tall. എവിടേക്കാണ് P wave tall ആയിട്ട് നമ്മൾ കാണുക? See, whenever there are many conditions, okay, usually right atrial enlargement ന്റെ സമയത്ത് P wave tall, peak അല്ലെങ്കിൽ tall P waves നമ്മൾ കാണാറുണ്ട്. Okay, fine. But in hypokalemia also what we get to see is a tall P wave. So പക്ഷേ ഇവിടെ, okay, the reason is what? Hypokalemia, potassium കുറഞ്ഞതുകൊണ്ടാണ് P wave tall ആയിട്ട് വരുന്നത്. So but the actual reason, normally tall P wave, it is seen where? Right atrial enlargement. പക്ഷേ hypokalemiaയിൽ right atrial enlargement is not seen. Okay, ഇതൊരു transient ECG change ആണ്. P waves കുറച്ച് വലുതായിട്ട് കാണാം. അതുകൊണ്ട് തന്നെ hypokalemiaയിൽ ഇങ്ങനെ tall ആയിട്ട് കാണുന്ന P wavesന്റെ പേരാണ് pseudo. Let me just change my pencil. Yeah, okay, pseudo. You can see, pseudo P pulmonale, pseudo P pulmonale. See, pseudo means what? False. P pulmonale. So tall P waves. Here we can see. But the reason is not right atrial enlargement. Here the reason is what? Hypokalemia. So that's why the name pseudo P pulmonale. And see, right atrial enlargement there are many conditions, mostly chronic lung diseases, pulmonary artery hypertension. See, pulmonary artery hypertension ulla samayathu endu vettum? Yeah, the pressure in the right side of the heart increases. So right atrial, eventually it can lead to what? Right atrial enlargement. Okay, fine. Now next is what? Next finding is prominent U waves. U waves nachala, see, T wave in shesham sometimes, okay, in hypokalemia another wave can be seen, that is called as U wave. Okay, and then also you get to see prolonged QT and PR interval. Prolonged QT and PR interval can also be seen in hypokalemia. So whenever, remember guys, see, QT interval kooduna samayathu, there is always chances of what? Tachyarrhythmia, right? So heartbeats can increase, and this this is called as, okay, torsades de pointus. So basically what is it guys? It is nothing but it is a polymorphic ventricular. Oh, my charge is going so low now. Okay, so it is a polymorphic ventricular tachycardia, and this torsades de pointus, okay, if you ask me what is torsades de pointus, that's what I said. It is a polymorphic ventricular tachycardia which can eventually lead to sudden cardiac arrest or syncope. Alright, now tell me, okay, the last slide, what is the cause of death in hypokalemia guys? It is diaphragmatic paralysis, okay, that can lead to death. What is the treatment? You will give, definitely, if potassium is low, you will give what? Potassium chloride along with intravenous fluid. You will dilute potassium chloride, that is with intravenous fluid, and you will give the patient. Alright guys, so let's call it a day. I'll see you tomorrow if time permits. God bless you all. Bye bye.